So I'm here today for our interviews with experts, actually in Albuquerque, New Mexico, with a good friend of mine and a former graduate student in my lab, Dr. Christopher Neumann. Chris, welcome, and would you mind telling us a little bit about what you do?
Sure. So I am the primary behavioral health provider at an outpatient primary care clinic in one of the main hospitals here in Albuquerque.
Okay. You know, most people, I think of a psychologist as working in an office 50 minutes at a time, and that's not at all what you do. You have a very different way of interacting with patients. Can you tell us more about that?
Sure. Yeah, the model that I practice in primary care is very different than a traditional mental health model. So it basically adapts to the needs of primary care, and that means that primary care is typically a setting that is fast-paced. You see a lot of patients, and you don't have a whole lot of time to do a very thorough diagnostic assessment and treatment plan. So the way that I work is kind of hand in hand with the medical providers. They get me whenever they need me, so I'm always available. And I meet with patients on average for about 30-minute visits. And really, rather than trying to design a treatment program, whether we're talking about mental health or we're talking about behavioral health issues like wanting to make health behavior changes, my goal is really to help them to work collaboratively with their provider. So I might meet with them only for a few visits to target a few key things that I think can make an impact on their overall functional status.
Okay. So a patient comes in and sees their doctor, and they identify something, either a health behavior or some mental health issues, and they go and grab you.
Exactly.
Do you see them right in an exam room? Do you take them somewhere else? How does that happen?
Yeah, so it depends on the situation. Sometimes, if I'm not already working with a patient and a provider comes in and gets me, they will introduce me to the patient, and I might spend a few minutes talking with them, and I might do a brief intervention right there at that time. If I'm not able to do that, at the very least, what I do is introduce myself, talk a little bit about the behavioral health services that I offer, and I'm able to schedule an appointment with them.
Okay. Brief intervention is probably a new term for our audience here. What does that mean? What's an example of a brief intervention you might do in that setting?
Sure. So, for example, if let's just say a provider says, I have a patient who wants to quit smoking. Can you work with them on that? Then I might meet with them for an initial visit, find out a little bit more about their smoking behaviors, quitting history, and help them to develop a plan within 30 minutes that they can then go follow up with their primary care provider on, and give them some ideas and tips. So making sure that they have good social support, making sure that they're not buying tobacco in bulk, or ideas like aversive smoking techniques, or brand switching, or nicotine fading, things that they can then carry out on their own without a intensive intervention on my part.
Terrific. I think this model is so neat that it kind of brings psychology to where people are instead of sitting somewhere waiting for them to come.
Right.
This is kind of a new model. Can you say something about how widespread it is or the future for integrated primary care?
Sure. Well, I think that the landscape has been changing and will continue to change. With changes in the healthcare overall and the patient-centered care and the medical home model, meaning bringing all services into one location, that invites behavioral health and psychologists into that equation. And so I think that will continue to happen. It will continue to incorporate behavioral health into the overall healthcare. In fact, some federally funded institutions like federally qualified health care centers require that they have some sort of a behavioral health provider on site. So there's incentives, I think, to bring psychology into a primary care setting, and I think that's only going to continue to happen more.
Sure. I know you're also involved in some leadership with this, trying to help disseminate information about this. Can you tell us more about those experiences?
Sure. So I'm part of the Division 38 Health Psychology Committee on Integrated Primary Care Psychology. developing a curriculum that can be available to training programs, whether that's at the graduate, internship, or postdoc level, to provide a curriculum for those programs that are interested in training their students in primary care psychology. So basically to provide the programs with kind of, these are the things that are needed to function in a primary care setting, and to give them resources and consultation with that as well.
So training the workforce for this new landscape of healthcare.
Exactly, right. And like we've talked about before, I think just trying to drop a psychologist with a traditional training kind of trajectory into primary care doesn't really work, because there really is a specific skill set that you have to have, and you have to adapt, I think, what you learn in your training program. You have to adapt those skills to the pace and the culture of primary care, and it's a very different culture than other areas in medicine, but definitely psychology.
Right. Well, you're actually a good example of when you were in training at OSU. I don't think there was such a thing as integrated primary care. We certainly didn't know about it.
Right.
Yet you found your way into that career. Can you say something about what was that path like for you?
Sure. So I actually wasn't seeking it out. My background was in health psychology, so I was interested in that. And when I started looking for positions, I saw an academic position that was for integrated primary care psychology, and I thought, well, this sounds interesting. Working alongside providers in a primary care setting seems right up my alley. And so I don't really think I knew what I was getting into at the time, although I was intrigued by it. And so I started in an academic setting and learning about what integrated primary care psychology was. Had additional trainings in that regard. Started teaching some of the courses. Started supervising students in a integrated primary care clinic. And then there came a time where I was ready for a change, and I wound up moving and found a position in integrated primary care psychology that is a clinical position, and quite honestly, I can't imagine trying to practice any other way than in an integrated model.
Yeah. You'd be surprised how many of our interviews with experts tell a similar story of kind of falling into opportunities, and things aren't necessarily always on a planned path. I think that's good for the students to hear, that you kind of follow interests. You had a background in health and brief interventions, but not in this setting.
Right.
And then opportunities present themselves and you take advantage of it.
Right, exactly. Well, I think that you have to be have an idea of where you want to go, but also be open to those experiences. And I would say even in graduate school, that turned out to be the case for me, where I had an interest in health behaviors, and I started off being interested in nicotine and tobacco, and then shifted to being interested in college student drinking and motivational interviewing. And so it's having an idea of where you want to go, but being open to that experience is very important.
Well, Chris, thanks so much for joining us.
Sure, thank you for having me.